Hi, my name's Lane. I'm a UMS student in P. I'm going to be doing a quick respiratory assessment on you today. So I'm going to start by assessing your back half and then we'll move to your front. So if you'll start facing this way, we can begin. Okay, I'm just going to fill really quick. So as I'm starting, I'm noticing that her skin is pink, smooth, warm, dry. She has no nevi present. Her chest is symmetrical with her AP diameter 2 to 1. Her respirations are unlabored and even with no obvious retractions or accessory muscle use. So Kerrigan, I'm going to palpate your back first. So just tell me if there's any pain or tenderness, okay? Is that okay?
Yep.
Okay. We're going to do that same thing again, but every time I move my hands, I want you to say 99.
99, 99, 99, 99.
All right, so chest is non-tender and expansion is symmetrical, and then her tactile firmness is symmetrical as well. Okay, so next I'm going to be doing the percussion part of the assessment, so it's going to be some light tapping. So just tell me if you're uncomfortable or if anything's painful, okay? And as I start my first part, I'm going to have you first take a big deep breath in, exhale and hold it, and then we'll move to inhale, just whenever I direct you, okay? You ready? Okay, let that go. Quick. All right, now we're going to go to the inhale portion. I'm just going to mark. I'm going to do that on the other side. So we'll start with exhale. Okay. Almost done. Okay. And then we'll do the inhale. Okay. And I marked this and then right there. So as I measure, I'll go to my centimeters. I'm sorry, you can breathe normally. I don't know if I told you that. Good job. Okay, so her lungs descend 4 centimeters bilaterally. And now I'm just going to be percussing your whole back, okay? So you can breathe normally throughout this. Lungs resonant throughout. Okay, now I am going to do your CBA. So I'm gonna basically percuss again, but I want you to tell me if there's any pain or tenderness, okay? Is that okay?
Yep.
Okay. No CBA tenderness noted. Now I'm going to go to the listening part of our assessment. So I'm just going to have you breathe normally throughout this, but if you will, I'm going to, as I move my stethoscope, will you take a breath in and kind of synchronize with that. And you just let me know if you need a break. I'm going to start with my diaphragm. Ready? Good job. I'm going to turn it to my bow. Get right here actually, sorry. Okay. So lung sounds were clear throughout all fields. I didn't notice any adventitious sounds or crackles or anything like that. And that's bilaterally. And I did not hear any or auscultate any renal bruits bilaterally as well. Okay, so now I'm gonna go through a whole thing where we're gonna make funny sounds while I listen to you. So I'm gonna do the same sort of pattern, but as I move my stethoscope, instead of breathing like how you were, you're gonna say E. Ready? I'm gonna move back to my diaphragm.
E, 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 E,
egophony noted. Now, instead of saying E, you're going to say 99 with each movement. Ready?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good job. Okay, so no bronchophony noted. And then now, instead of saying 99 normally, I'm going to have you whisper it. And then we'll be done with this part. Good job. All right, so there's no whispered pectoraliquy noted as well. Okay, we finished with the posterior part of the assessment, so I'll have you flip towards the camera and then we'll do the anterior. Okay. I'm going to start by assessing. I'm just going to look at your chest and your skin. Okay. Her skin anteriorly as well as pink, warm, dry, smooth. There's no deformities. I see that she's breathing at a regular rate of 18 breaths per minute, and I don't see her working hard or having any sort of retractions or trouble breathing like that. What we're gonna do next is I'm gonna palpate. So like I said on your back, like just let me know if you have any pain or tenderness or anything, okay? Any pain or tenderness?
No.
And like we did on the back, we're gonna repeat you saying 99 as I move.
99, 99, 99.
Okay. Chest is non-tender, expansion symmetrical. There's no lesions, heaves, lifts, or thrills. Let me think about what else. Her tactile firmness is symmetrical as well as it was posteriorly. Okay, so now I'm going to do percussion again, so I'm just going to be tapping all over you again. Okay. Come over here. Good job. Lungs resonant throughout. Now I'm gonna listen again. Just have you breathe normally like we did on your back. Lung sounds were clear in all lung fields. There were no adventitious sounds or anything like that. And then I don't know if I mentioned this previously, but when I was listening to her posterior, she did not have any renal bruits as well. Thank you.